everyone. Today we are reporting 66 new cases of COVID-19 in the state of South Dakota. This does include 2 new hospitalizations and 2 new deaths, one in a Lake County and one in a Pennington County resident. We have 55 newly recovered individuals and a total of 413 new persons tested negative for COVID-19. This does bring our total COVID-19 case count to 8,143. Of those, 808 are considered active infections, and 7,214 individuals have recovered to the point where they're no longer able to transmit COVID-19. We have 50 individuals who are currently hospitalized, and a total of now 121 deaths. This does mean that a total of 93,393 total persons have tested negative for COVID-19. We have no updates for the community impact map for today. For our cluster update, we have one report and update, which is the Eventera St. Cloud facility. We have 37 individuals who have recovered out of 68 total cases among residents and staff. I won't run through the new cases by county because I want to give a couple other quick updates. So first, that I wanted to have just a quick clarification on the difference between tests completed and persons who are tested. So on our website, we are currently reporting, and we currently surpassed 100,000 persons that were tested in the state of South Dakota. Now, some individuals are tested more than one time, and so we're over that 100,000 total tests. And the information specific to tests, it will be rolled into our new dashboard update, which we'll be releasing next week. The information that I wanted to say is that some of those dashboard updates are to simplify and clarify some of the information that we have on our website. We're also combining the 2 dashboards that you see. So rather than having a longer scroll to look at the case information at the top and some of the trend data at the bottom, it will be all in a single dashboard with tabs across the top, and we'll talk more about that next week. And that it will include information on our testing data, and that will include things like our test positivity rate, our total tests that have occurred in the state of South Dakota, and the progress, percent progress toward our monthly goal. The other thing that I wanted just to mention as we're kind of talking through some of the changes that CDC has updated their guidance on when a person is considered recovered. So for the majority of the individuals that we work with that have that we monitor their infection, most of those individuals are released after 10 days. 10 days after they have their symptom onset, and at least 24 hours have passed since they have resolved their fever and they've had general improvement in their symptoms. For a small portion of individuals who are positive that we're going to be monitoring, some of those individuals may have severe illness, and some of those may be severely immunocompromised, and that really is where the CDC change is occurring. So they are, for that small group of individuals, CDC is lengthening from 10 days to 20 days. That is, as a minimum, the time when an individual is being under isolation, and so that time before they're actually released from isolation. The other side of that is that when we're looking at our recovered, we have had some individuals who have had a much longer recovery, and really what this allows us to do, that 21-day mark, is to denote them as recovered, as CDC has not identified any potential transmission of individuals past that 21-day mark. So this does work in two different ways to increase the length of time that some, again, a small proportion of individuals will be in isolation, but it will also allow us a smoother way to transition individuals from the active to the recovered categories. The last thing I would like to mention kind of goes back to the dashboard pieces as well, which is that CDC has made available through a contract that they have with Esri, which is well known in the mapping world, an ability for states to enhance some of their existing dashboards. And so the Department of Health is partnering with Esri to look at some of those enhancements beyond some of the changes that we're currently making to our internal dashboard, to our dashboards that we're posting to the website. And those are going to be taking longer to work through, but we're hoping that that will provide some additional data that individuals can look at. A couple of the things that will be available there is looking at some of the race data by the individuals who have deceased or individuals who have been hospitalized, in addition to the case level information that we currently post on our website. So more and good, interesting stuff to come, and we'll start that process by rolling out our new dashboard next week and have additional updates as they come available.
All right, thank you, Dr. Clayton. We're going to go ahead and open up the lines, and we'll take your questions. All right, we're ready for your questions.
Hi, this is Blake. This is Blake Joseph from KVM Black Hills Fox News. Rapid City Mayor Steve Allender has suspended his weekly press conference because of what he called a lack of communication with the South Dakota Department of Health. Would you mind to comment?
Sure. This is Kim Alton-Wright, and I'll be frank, I was really disappointed to hear that from the mayor in terms of attacking me and my team. We have done a colossal amount of work on the COVID response, including in providing data and regular updates to a whole host of individuals, including the public, the media, healthcare providers, other stakeholders. So I was pretty disappointed to hear that. I think that thanks to the leadership of Governor Noem and our team, we've had a great response to COVID, and I'm disappointed that he has chosen to not continue press conferences in light of the fact that we're providing more information now than we've provided ever in the past. And so I think somebody might want to question whether being discontinued because it's not from a lack of data.
Next question.
This is Morgan at the Rapid City Journal.
Go ahead, Morgan.
If I can just go off that question, I think the issue was maybe that the Department of Health didn't notify the city office about the outbreak at the two Aventura facilities. Is that standard operating procedure for the department, or will that change in the future to kind of keep communications open about outbreaks in cities?
Sure. So that's a great question, and as some of you who have been on these calls are very aware, we report clusters involving nursing homes, businesses, other settings where we know that there's a number of cases that are related to that potential exposure setting. We will continue to do that. And depending on the circumstances of that cluster, there are different notification protocols. Obviously, in the case of a nursing home, we work with the nursing home, and in most cases, those nursing homes do additional notification to their local partners. We expect that to continue to happen, the other thing that I would just remind folks of is if there's ever a risk to the public associated with a cluster or with a single case, we do additional notifications so that individuals can take the right precautions and help keep themselves safe.
Next
I have
question.
a second.
Go ahead.
Tests can take a little bit of time to come back for some people, so I just wanted to check again if any cases arose from the July 4th weekend or even the July 3rd fireworks at Mount Rushmore. I just wanted to check.
Yeah, so this is Dr. Clayton, and the testing that we've seen, you are correct that there's a little bit of a longer delay for some of those outside commercial laboratories, but that has not changed the statement around, any potential cases or clusters of cases that have been occurring in Pennington County or some of the other Black Hills area. We have not seen a specific increase or a specific event, transmission event associated with 4th of July fireworks at Mullen.
Next question.
Hey, Ray from Kellerland.
Go ahead, Ray.
Yeah, just to follow up on the pending, can you give us an idea of how many tests are still pending, even a ballpark of ones that haven't been processed yet?
So that is a number that we, would not have access to. We get the results reported to us, positive and negative, and so we don't get the information around when tests are sent out for that testing, or when specimens are sent out for that testing. So not something that we can quantify is that number that may be sitting, the number of tests that may be sitting at those outside commercial laboratories.
Next question.
Hi, Todd F. Fellow.com News.
I heard Todd.
Yeah, thanks. This is not so much a question, but a plea for help from you two, Dr. Clayton and Secretary. A couple of weeks ago, Governor Noem put out a tweet that challenged us in the South Dakota media to talk to a couple of medical researchers at Stanford University and their research showing that the wearing of masks is not all that effective. Well, I've spent the last day or so trying to contact these people. I did have one short message from one of the researchers who said he had talked with a member of the governor's staff at some length, and I've yet to hear from the other gentleman. Is there anything you guys can do to pave the way so those folks would maybe talk to us about this so we better understand the governor's perspective on masks?
This is Kim Alston-Rice, and thanks for bringing that up, and we'll see what we can do in that regard.
Okay, thank you. Appreciate it.
Okay.
Next question.
This is Stephen Groves from
the Black Hills Pioneer.
I heard Stephen Groves, and then we'll go to the Black Hills Pioneer.
Yeah, thank you. I was just wondering, with plans being made for the fall with public universities, schools, and high school sports, I know there has been a call from the South Dakota State Medical Association that masks should be worn in school buildings. I was wondering if you could tell a little bit about the guidance that the Department of Health is giving to schools around activities and going into school buildings.
Stephen, this is Kim Alston-Rice, and I can speak generally to the process that we're using to work with schools. We and the Department of Health and the Department of Education have been communicating with schools for some time now about COVID and about the latest guidance that is out there from various organizations. And so in the world of education, there is guidance from the CDC about COVID response and mitigation. There's also guidance and helpful information from some of the education-oriented groups. And so really just working through with school superintendents and their staff to understand what that guidance is, to understand kind of the elements of the planning that they're needing to embark on, and then providing technical assistance and assistance as we get into what is becoming closer and closer to the actual school year, so that they have the support that they need from both the Department of Education and the Department of Health to educate kids safely and hopefully in person as much as possible, because we know kids thrive in the situation when they're able to go to school and interact with their teachers and interact with other students. And so it's a very ongoing effort. I think that it's we obviously are always working on a number of priorities in terms of our COVID response, but I can tell you that it is one of the highest priorities to work with that group in the coming weeks so that people are comfortable with the start of the school year.
And this is Dr. Clayton. One thing I would also mention is that, when you're looking at the vast amount of CDC guidance that is out there, and they do have a lot of good information, specifically for school settings. There's not a recommendation, to mask in those within schools. There's a recognition that there are going to be variations in terms of the impact of COVID-19 within communities, the factor around acceptability within school districts and so on, and I think that's really indicative of the CDC is not making a specific recommendation that they're allowing individual school districts or individual states to make that recommendation, and that continues to be our position as well.
To follow up with that, can I ask if the Department of Health is preparing for the start of the school year in any way in terms of, conducting contact tracing within schools, or getting ready for any increase in cases, or prepping the healthcare systems to kind of address just the start of schools?
Stephen, yeah, that's a great question, and that's very much a part of the planning that we're working on right now. And so I'll just maybe address the example of contact tracing. And so contact tracing, in the instance of a youth that has been in a school setting, will necessarily have to include information. And so just really mapping out how contact tracing works, the information that we will need from schools of a person who has been in the school setting, and notification processes, mitigation processes, disinfection processes, all of those kinds of things are the kinds of things that we're working with schools on right now.
Now we'll go to the Black Hills Pioneer.
Thank you. So we know that the positive case numbers that are being reported are all South Dakota residents. Is that the same for the negative case numbers?
So the information that we have on the negative persons that have been tested is that, yes, as they're being able to be assigned to a county, those are specific to South Dakota residents. Obviously, we don't get all of the information. We don't get all of the residents' information all the time, which is why we have that unassigned category of negative tests. And so for that specifically, there is the possibility that includes some individuals who were tested at facilities in the state of South Dakota that are not South Dakota residents. But again, if that information is known, that is reflected appropriately on our website in the appropriate county, and that we do obviously notifications of cases and persons who have been tested to the appropriate state.
Do we have any idea how many non-residents are being tested in South Dakota?
That's probably a better question for some of our healthcare partners. Overall, we know that we do provide those numbers to those positive and negative results to other jurisdictions, but we don't specifically track or quantify that in any meaningful way.
We have time for one final question.
Ray from Kelland.
Go ahead, Ray.
Just getting back to the dashboard where you identify negative cases per person, did you have to do any subtraction then to get to that number? If you were counting total tests as negative cases, yeah.
I'm not fully sure I understand.
Okay, so you're identifying negative tests per person now, and were you just identifying negative tests as the number of negative tests processed? So did you have to do any subtraction at all to get to today's amount?
No, what I would say is that the update to the test has not occurred yet. That's going to be in the dashboard rollout for next week. So everything that is represented on the website, that total total persons testing negative, it also includes individuals who may have been tested negative multiple times, as well as that positive cases may include individuals who had a positive SARS-CoV-2 test multiple times.
Okay. Okay. So where today it's changed to persons, we should just ignore that piece and okay,
Nothing
got
has
it.
changed today on and how we've reported. What
Okay.
Josh has been talking about is upcoming changes that are coming next week, which we'll explain more once they launch.
Yeah, so we'll
Okay.
have more information on test-specific information. Everything that we've been reporting on is person-specific. Yep.
Okay. Thank you.
Yeah.
Thank you all for joining us today, and we will visit with you again on Monday.